so before I introduce you guys to IntrowHEALTH, I want to share why we got in this new grant. So again, just recap to what we discussed this morning. We know how much the HIV diagnosis is equal a social stigma. Now over lunch I was talking with a bunch of people here, and I think the stigma is the word we hear over and over again. And again, we know how much this brings like a very extensive social challenge for women. And somehow women are way more vulnerable to some life events. A couple of days ago, I had this in my computer, somehow I lost. I couldn't find last night and I couldn't put back because I really thought it was a good way to explain how we are as a women. There was this cartoon on the internet to say, man, if you try to understand the women, we are like 300 tabs open in your computer. That's the way we are. They are all open at the same time. So women, that's the reason. Like we think in many aspects differently. We suffer things in a different way. And somehow we are, and even just going back to what we discussed earlier this morning about mental health, it's way more common mental health problems in women, right? And probably has to do as a consequence of this life events we suffer over a lifetime. And again, we know HIV stigma is the most significant challenge women suffer. Okay. And if we think about HIV stigma and women, we know how affect self-esteem, lack of self-efficiency, make women to feel like helplessness, and so, for sure increase the psychosocial stress. We know also, and just thinking what Alison presents to us before lunch, we know there has been one of the biggest challenges is how to encourage women to access some relevant health and social service. There's a lot of logistics barriers women have, it's child care, it's big, like Brittany was saying, she has to charge her phone because, the daycare can call anytime. We can't leave the house because we have young kids and daycare costs too much money. So we can go on and on with some of the logistics we have to put in place. And again, I think just women is able to think and all these things in the day-to-day life. And so that's one of the reasons. Women, they have so many other stuff to do, their care is going to be the last one. So another problem is the fact we know a lot of the HIV care is not designed by or for women. And that was one of the things we always felt proud at the IntrowHEALTH team. All the team is women. We had to change a little bit over for IntrowHEALTH. We had to accept some men. But the idea was really this program, this intervention was developed by and for women. Again, women have so much fear of the HIV, to disclose their HIV status. A lot of as we know, a lot of the support for women has been done in group, and we know, and we heard this in IntrowHEALTH. It's one of the barriers for women to go. They don't want to walk in the AIDS service organization, and they don't want to be in the group. Who knows what's in the group, and I'm not going to go there and perhaps see someone from my community. And they are very afraid even if they pass these barriers, they walk in, they go to the group, the fear of the breach of confidentiality and privacy, it's very, very, one of the reasons women don't go. So again, just recap some of the good things we learned with IntrowHEALTH was, like we see in terms of the surveys, the women felt, some increasing in mental health, quality of life, and perceived social support. They felt depression was less. They felt through the interviews from the Alison showed to us before lunch. They felt, there was this support support, and they see the peer case managers as a mentors. They felt it was an effective way to connect with the women, with service. They really value the flexibility of a meeting place, and Tina was saying this in the panel in the morning as well. And they had this sense of the intervention helped them to move forward. We also learned, we actually learned a lot with WHEALTH. I'm just making a summary. We learned the intervention really can help women and support them. And perhaps can link them with other community service. And in the end, improve social support and access to care. What else do you learn? Like Alice will say, it's not for everyone, you know. It's not an intervention for women hard to reach. And then back last summer, we did a community forum, like this one we have. And the things we got as a recommendation from the community saying, okay, looks like WHEALTH is a very good way to approach women. How about, but it's not for everyone. We have to go further than those women who already passed the initial barriers. And there is women, they are so far away, so behind in the process, they don't feel they are ready to see someone face to face. Or they live so far away, they can't leave the house, or for some physical limitations, they can't get out. There is no way. So how about if you guys thinking about to put this intervention online? And that came from the community. Again, we thought that would be a way to reach women who are, for example, not ready to again go to the community. Because, like I was saying before the lunch, we thought, okay, the project is done, the results are there, let's give this to the community to implement. And one of the things we heard from the community, well, but maybe the women are not ready yet to just join the aid service organization. And then they said, well, how about if you guys create an online intervention? And at that point, we already had the third grant from WHEALTH. So we did the initial capacity building, we had the CHR operation grant, and then we had a knowledge translation grant. And as part of the knowledge translation, we already thought at that moment, perhaps we could have a website, the WHEALTH website, where we could, for example, have, that's the reason we are recording today, have this available for women who didn't came to the meeting today because they were so busy with other things. Or even for other communities, like we, Alison, Mary and I, we went to BC last year, right, or the year before. And in BC they were really keen to learn more about the intervention and how to deliver this intervention for women. So we thought maybe the website is a way to keep the women in contact or share the information we learn around this intervention. That was an idea. CHR was keen to say, yeah, you guys should do that, gave the money, but we were not ready yet. So we had a lot of more stuff to do. And one of them was the community consultation. So what I'm going to show to you guys now, it's really funny. No one saw even Alison, because I just got half an hour ago from our web developer. And that's the thing, we had to include men in this project because apparently women doesn't do this kind of things.
Yes,
there are.
It has been a very funny challenge to learn some of the language these people talk, you know. I'm not there yet. Anyway, so I just got from our web developer a few minutes ago, and I'm going to show to you guys what WHEALTH website looks like. Okay? So the idea, first of all, and they didn't have a picture so far, so they had to put some funny pictures. Doesn't look nothing what we do, right? You guys are gonna see us moving the pictures. It is a lot. They don't get it what we do. Well, look.
It's a work in progress, right?
That's like they just sent to us, and I couldn't handle myself. I had to show it to you guys. website, it's be the most simple website possible with anyone could access. And be a place where we can share these informations, like manual. If you guys go here, you see you can download the manual, okay? So the manual for the intervention, it's there already. If you guys download here, you are gonna see, should be. That's me apparently. I don't think Liz Binder is gonna be happy. That's Mary. And Alison. So again, that's one thing they put here already, you know. If you want to contact anyone in the website, you know, the women can contact. And the way the website was designed, because when I met with these guys, I will say to them over and over again, it's privacy and confidentiality and easy. That's the 3 words I want on this website. How you guys are going to do that, I have no idea. Because the idea is to be the most secure website in the way, if you are home and you log in, no one is going to know you log in, right? So the way they did the website, they delete the cookies. That's what they told me. So when I go back to the website, I have to type the name of the website again, okay? And there is another way to create a security in the website. For example, if they don't create the second level of security, if I go to my Google in my computer and Google WHealth, can somehow show who accessed that website in the past. You know, you need to be a little bit geeky, but you know, I'm pretty sure my daughters can do that. So they create this website in a way, there's no way for this to be done. So the idea is to be the most secure website you can go, including you can ask questions and no one is going to know who you are, you know. And this whole thing about the website is to prepare for, oops, as you can see I'm not the best, is to prepare for the EWHealth, okay? That's a provision we have to discuss as a team. And actually, if anyone wants to design the logo for our intervention, that's up to a competition. That's just some things I did last night to make an idea, because maybe put the logo of WHealth in the keyboard of the computer. Because the idea would be from now on, in that website I just showed you guys, we're going to have an icon for the women to learn about the intervention. Okay? And what's this intervention for, and who a women can access this intervention online. We're going to do, we have to go through studies the same way we did the intervention, right? And we are going to, the idea is to check this intervention works the same way it works face-to-face. We don't know. We think probably even better. But again, to say anything about how effective or how applicable is this intervention, we have to test. So we're going to do a study. This is a couple weeks ago or a month ago. We got be accepted by OHTM, and they give the funding for us to do this intervention. So we're going to compare the initial WHealth intervention with the same intervention online. So any women, just a question you guys asked earlier, any women can access, as long as they have 18 years old over, and if they are willing to attend the sessions, they can be part of the study. We had a discussion as a team who is going to be excluded, and we have to say some things to the funders and to the ethicals, but you know, I think it's really up to our interpretation who is going to be excluded. You know, as long as the women are able to, they feel they can access, even if they have a dementia, I think they should. You know, unless the dementia is so bad they can't use the computer, for example. That would be one of the limitations. medications. Or if the woman is so depressed, they need to be in the hospital because they have suicide risk. So maybe that's not the moment. We have to delay this a few more weeks. Or if the woman is so physically sick, again, we're going to leave to the women say if they feel they can or not. If they have an opportunist infection or any cancer, that perhaps would be something we have to delay. And we have to exclude the women who participate from the initial study who received the intervention. The women who were in the W health, but they didn't get the intervention, they get the standard of care, they can participate. Okay? So why we have to exclude who participate? Because that it's not fair with the intervention to test, you know, and perhaps we're not going to find results saying it doesn't work because the women received the initial intervention. Okay? And again, the objective is to evaluate the effectiveness and applicability of the online intervention compared with the face-to-face. And we have a few more questions, you know. We are going to take the opportunity to, because again, came from the initial study, we really want to understand a little bit more about HIV stigma and how this affects the capacity, it's a barrier for women to access care. And there is another thing we put as an objective. We really want to understand a little bit more about what peer means, and Alison described this earlier in the morning. We really want to understand about the matching, you know? It's all about matching and the chemistry. So how important it is and how this has really affected the decision of women to connect with a peer or not, you know? And one of the things we are going to, again, use the website and use the pictures, is to have the picture of the peers and a brief description of who they are. So Mary is going to be there in her picture and say who she is, what she does, and her personal history. And when women contact us to take part of the study, we're going to ask them, did you see the pictures? Who you would like to be work with? And we really hope in this way we are going to be able to, you know, have some insight about the matching, you know, and see it's a cultural, it's a color, it's an age. What exactly makes a good match between a client and a peer? And I think that's one of the questions we have very often, right? So the logistics, I know Alison didn't give too much time for me, so I have to, you know, just give you an idea how this is going to work. So imagine women are going to know about this study. We're going to have this in the clinics again. We really hope in the next few weeks with the website, with the real pictures, we are going to have, and you guys have the address, it's www.whealthintervention.ca. So you guys can access this website at any time in the next few hours. Actually, it's there, it's just the funny pictures. So women are going to learn about the intervention through the website, through talk to each other, through the clinics. So they are going to be able to click in the website and, or if they don't want to, you know, they don't have a computer, let's say, right? We had to think on all these details to put this intervention on. So imagine you went to the clinic and you got the information, there is a number, and the person is going to call Alison and say, I heard about this intervention and I want to take part, I just don't have a computer, okay? And I'm going to answer how we're going to do that. Or a woman click on the website and say, send the email. Again, the email is going to be very secure. No one is going to have access to that email. The woman will say, I would like to have more information. And Alison is going to reply, saying, you know, that's me. I am calling you or I'm emailing you. And the woman is going to say how they want to be contacted, phone or email. Okay, so the women get the contact and then, you know, make sure, explain to how the intervention is going to work. And the woman is going to get a package with all the questionnaires they have to complete and the consent they have to give to us, right? The package is going to be mailed, okay? The women complete and send back with the prepaid envelopes we're going to get in the mail. So, and everything is going to be organized by women in that telephone or email conversation, okay? So, and then as part of this conversation, women is going to be asking, so did you see the pictures we would like to work with? And then, let's say, I say I want to work with Mary, okay? So Mary gets information from Alice and say, okay, there's one client for you. And Mary contacts me to say, let's start to plan the sessions. And again, keep the flexibility the women had and appreciate the initial interview. So the sessions are going to be done through video conference, okay? And that was one of the things the team decided after so many conversations, because again, women value the fact that they were seeing who they were talking to. Initially we thought maybe we can do this chat, and we realized it was not exactly what women appreciate in the initial intervention. So they're going to do this through teleconference. The way it works, the day before, so imagine Mary and I, we agree, tomorrow at 11 in the morning we have a session. So Mary today, okay, email me with an ID, okay? It's a code I get. Every single time before the session I get a different number. Why that? If a geeky person try to hack my computer, they will never be able to get in through the conference like when I'm talking with Mary, okay? That's, again, it's a security measure we had to take to make sure that the privacy, it's important for us, right? So, and then, okay, that every time before each session, I'm going to get a different ID. To access, besides the ID, I need a login, okay? So I know it sounds very complicated, but again, it would be part of the intervention. Women are going to receive a training for this, because not everyone is geeky computers, right? So the idea, we are going to really have training and support for women who are not very comfortable to use computer. So when I create an ID, I have to create an ID that doesn't look like Adriana's name at all. You know, it's a nickname. So because again, we don't want to identify these women whatsoever. Okay. So let's think about if the women don't have a computer. Okay. Again, we want to be inclusive as possible. We just learned in the initial intervention, women who don't have telephones can access to the intervention. Imagine if we're doing this through the computer. As a research study, we are going to provide the women with the computer, okay? And then Mary and Alice is going to remember some of the conversation. I always try to be as cheap as possible, right? Save money to have more women access. And they had to change my mind, because initially I said, okay, let's do this to chat. Any women can go to the library and they can do the intervention. No, but if your video conference doesn't work, they have to be in their home, right? They are not going to talk in the computer in the library with someone, you know. So yeah, we're going to provide the women with the computer if they don't have. This computer is going to have an internet access, those rocket mobile internet, whatever they call, and the computer is going to have, of course, a video camera. Okay, so when the women sign with the case manager, they get in the mail the computer. It's going to be as tiny as that one to be easy for women to have a computer. Maybe women have a computer home, but they don't have an internet access. So then we're going to send that rock mobile to internet. Or maybe they have everything, but they don't have a camera. We're going to send the camera. It's really try to be offer this intervention as much we can for women, even if they have some barriers. Plus, like I said, it would be part of the intervention to get some training in the computer. Simple things, for example, let's say Alison is part of the intervention and of course she doesn't want anyone in her family know she accessed that website. So we're going to tell her over and over again, every time after you finish the website, you delete the history. That's the way we do, no one can see what websites we checked before. So this will be part of the training each woman is going to receive to be able to access this intervention. I think I mentioned this before. So I want to really leave now the last 2 minutes Alison gave me to your questions, your comments around this next step we are taking from the IntrowHEALTH team. What you guys think? We are crazy? Or it's a reasonable thing? Or what kind of barriers perhaps we are going to see, perhaps we never thought before, and you guys doing this, supporting women perhaps would know what kind of things we can anticipate.
I just tried to access from my iPhone the website, but it doesn't have a whole capability, it looks like. Is that in the works or is it not?
Actually, because to the end of the day, we have to go, and I can give you can access through phone or iPad. The only thing we are, until the end of the day today, it's just because I really want to show to you guys, we are inside of the web developer hosting, that's the word. We have the domain, that's the domain, it's a language I learned, but we need a host. Okay, so the host is what the guy is doing this afternoon. So at the end of the day, you just type www.intervention, that's IntrowHEALTH1, and we go there. Now we have to put other letters before.
If someone sees it on a bus or in a clinic or something, they can go right on the phone?
They can.